Hi, everybody. Jay with Somnilopod here. Wanted to give you a little bit of an introduction for this episode. This is one of those disorders that I just think is fascinating. It falls into the realm of parasomnias, which is a group of sleep disorders that are just all of the really bizarre, weird things that happen to us at night. So give it a listen. I hope you enjoy it. Please send me some comments, leave some impressions. Please like if you are inclined, and subscribe if you are inclined. And I will talk with you next time. Thanks.
We've all heard of things that go bump in the night, but have you heard of things that go crash or bang or kapow? I feel like I'm in a comic book. On today's episode, we'll talk about an extremely annoying sleep disorder called exploding head syndrome. It's not what the name implies. I'm Jay, and this is Somnilopod. You know, I love talking about the weird stuff that happens when we're sleeping. And I really wish that I had been in the meeting when the physicians got together to name some of the different types of sleep disorders and just sort of codify them into one sort of compendium. But somebody in that meeting really should have paused when they came up with the name exploding head syndrome. It sounds like a cheesy sci-fi movie, and honestly, I would probably watch it. However, the disorder itself can be really disconcerting. Imagine lying peacefully, falling asleep, and suddenly you hear an intense noise like a crash or lightning or fireworks or even a gunshot, and being startled awake from sleep by it. Patients who suffer from exploding head syndrome experience that very thing. Unfortunately, cases of exploding head syndrome, or EHS, tend to be more common in women. Ladies, you got it rough. EHS typically begins to present itself around age 50, so it starts to occur a little bit later in life, and it is more common in women by about 50%. Now, it can occur independently. It may just happen once in an evening. It may just happen one night and not happen again for weeks. It may happen multiple times in one night and occur for several nights in a row. And as if the noise itself isn't bad enough, some patients actually report flashes of light with the accompanying sound, as well as muscle twinges, although those two symptoms tend to be a little bit less common. Now, despite EHS being a fairly common disorder, about 10% of the population experiences it, very little is known about the origins of the disorder. Some theories say that it may be associated with a certain type of seizure. It's called a temporal lobe seizure. It's a part of our brain that is sort of between our ears and our forehead. Some also feel that it may be due to sudden shifts in the components in the middle ear. And we all remember from high school biology, the bones in the middle ear, the anvil. Oh gosh, I just forgot. The anvil, the hammer, the anvil, and the stirrup. I didn't even have to look that up. I'm so proud of myself. It took me a minute to get there, though. But sudden shifts in those components are some of the theories that may be contributing to this. And there are also studies that may indicate that it's caused by abnormal surges in activity in the neurons in a part of our brain called the brain stem. And it happens when we transition between wakefulness and sleep. So it doesn't necessarily only happen when we're falling asleep. It can also happen as we wake up in the morning. So it's that gray area between wake and sleep that people begin to experience this. As with many other parasomnias, exploding head syndrome is essentially benign. It doesn't really cause any harm. However, it can be very disruptive to your sleep. So when people find themselves experiencing it often enough, then it is going to be time to seek some treatment. Of course, the best bet is to touch base with a sleep disorder specialist. Some treatments include the use of tricyclic antidepressants. One in particular called clomipramine has shown to have promise. Now, there are also some theories that claim that exploding head syndrome is related to our stress level. So treatments will include managing our stress. Now, I wonder, did you notice how in this episode, I haven't referred to this once as blowing our mind? I didn't do it a single time. Well, maybe I did do it a single time, but I was feeling pretty proud of myself for not having used that analogy. So if you or someone you know or love has experienced an episode of exploding head syndrome, tell me about it. Send me some information. I would really like to know your thoughts. You can contact me at j@somnilopod.com. You can also follow me on Facebook, Twitter, and Instagram. Again, keep an eye out on YouTube. We're probably going to be doing some cross-platform stuff. As always, please remember to try to make sleep a priority. And until next time, get some rest. Bye-bye.